I nominated Dr. Doolittle. I saw him in class one day, so I just went and asked him if I could follow him around clinic, and he said sure. As a second year, you don't get much opportunity to do that, so I've been pretty fortunate to find Dr. Doolittle, who lets me come whenever I want to. He's so patient, and he never makes you feel uncomfortable about what you're doing, and that's really important to me as a student. And he's always wanting to teach you something. He just loves to teach, you can tell. His interaction with his patients is amazing. He's really good at just feeling out what the patient needs to know and when. And he knows when maybe they aren't ready to hear quite all of it yet, and when they're kind of overloaded with information. And the way he interacts with his nurses and nurse practitioners, they just have a very good relationship in their office, and I think that's better for the patient overall. When I got the email that we could nominate anybody, Dr. Doolittle came to mind first and foremost, because he's just a great doctor, he's a great mentor for me, and he does everything he can to help me out, and I really appreciate it.
I've just been amazed how good Dr. Hughes is with his patients, how compassionate and kind. For me as a student, really the best part was that he was so dedicated and enthusiastic about teaching. He's been really a wonderful mentor and teacher, and he had prepared some mini cases to help me go through thinking about different issues in surgery, and it has really helped me. It has elicited my curiosity. It was fun, and then it was a great motivation for me to learn more. His personality encompasses so many dimensions. He's very human, he's very bright, and he's very respectful to his staff and to the other people he worked with, and he was really very dedicated to his students. So it's just great to have one person having it all.
I've had the privilege of working a lot with Dr. Mcdonald over the past 2 years. I've experienced her in several different avenues, and I just feel she epitomizes what the Rainbow Award's all about, and she's just an excellent educator. I really just think she really loves her patients, no matter what they are, who they are. She knows about them, she knows their situation, she knows their families, and that I think is really special. She teaches you constantly. With her as my preceptor, I've really had the privilege of learning from her in that regard, and she's been excellent. And she's really spent time not just correcting me, but saying, oh, you're doing this really well, let's work on this. She never makes you feel dumb or unintelligent or like you're behind the learning curve. She keeps you feeling like you're progressing. She makes students smile when they hear a lecture. There's never a lecture that goes by where somebody doesn't laugh out loud in class. And I think the same goes for when she's teaching in the clinics, when she's teaching as a preceptor, and just even when she's working with her patients. She's always making somebody smile, somebody's day. She epitomizes the type of woman I want to be. So as a physician, as a mom, as a wife, just as a person, she's really great.
I really think that Dr. Meyer is one of the people that really shines through as caring for the students in almost every aspect, whether it be their education and just overall well-being. And truly does want us to learn as much as possible in both that academic setting and in the clinical setting, like at JDoc, making sure we know what's going on. He's constantly having forums and opening up new avenues for discussion, and we'll listen to all of our concerns regardless of how fickle they may be. We had a student that passed this past year, and he was really supportive with that and helped with the memorial, and it was just really good to know that there's somebody working that closely with the students that really does care and is there for us. He takes that care and concern directly with his patients as well as the students. Just having that compassion and concern for people, I think that that goes a long way.
I nominated Dr. Shelton just because he's been a big influence in my medical career from start to finish. He does a great job of teaching. He allows the students to get a lot of first-hand experience, anything from surgery to ER call to obstetrics. He kind of runs the show. I have not met a patient of Dr. Shell's that doesn't like him or doesn't feel like he's someone that they couldn't go to in a time of need. He sees everyone from newborn babies to grandma and grandpa, great-grandma and grandpa actually, and he gets along with them really well. They're very receptive to him. I would say that's probably his biggest attribute is his bedside manner. As far as interacting with patients, I'll take a lot of that, what I learned from him, but also interacting with staff, his peers as well as nursing or hospital administration. He's very friendly, he's very outgoing, he gets along well with everyone, and I think that's a big part of being a team player and making sure that the office or the hospital is working well is when everyone gets along and everyone works well with each other.